Hello, hi, this is Vaishnavi. Today we are going to see about breathing disabilities and what are all the assistive devices or what are all the equipments we can use in order to treat our disabilities. Okay, which is nothing but breathing disabilities. Breathing disabilities in the sense the patient may feel some obstructions while inhaling or exhaling. This kind of obstructions will create some huge impact on future. In order to reduce these kind of disabilities, the clinician may refer the patient to use some kind of assistive devices like Bi-PAP and CPAP, which is non-invasive breathing device. Okay, if the condition is not moderate, it is more than moderate, or the condition is severe, the patient should undergo invasive breathing procedure, which is nothing but intubation. Okay, first, if the condition is moderate or below moderate, we can go for CPAP or BiPAP. It is a kind of device which will give some preset or continuous range of pressure to the patient body to to perform the inhalation and exhalation. Okay, the clinician may set the pressure level according to the patient condition. Okay, after setting the prerequisites of pressure ranges, then the machine will deliver the pressure to the patient body. This pressure, actually what it does means, it will keep the airway open so that the air can enter into the patient lungs very easily. It will reduce those obstructions. It will actually help to overcome those kind of anomalies which is present in the patient airway. Okay, this both CPAP and BiPAP is a kind of, also it is a kind of assistive devices for breathing disabilities, but it is non-invasive. The air or the pressure is provided to the patient via the mask, which is wear on the nose alone, or to the entire face mask, a nozzle mask. Different kinds of masks are available. We will discuss in the upcoming video about detail about CPAP. What do you mean by CPAP? How it works, and what do you mean by BiPAP? How it works? What are the difference between those? We will see in upcoming videos. Now we are entering into the invasive intubation, which is most prominently used nowadays for the patient who are all in very critical situations. Okay, invasive intubation, invasive breathing. It is an invasive breathing procedure. How it performs, how the physician will perform this means by means of using this intubation technique. Intubation is nothing but it is a procedure where the physician inserted the ET tube into the patient windpipe. ET tube is nothing but endotracheal tube. The patient in the patient body. The ET tube is inserted into the trachea, where we can call it as a windpipe. After the insertion, that tube is get connected to the oxygen machine, which provides ventilation to the patient body. Okay, how we are gonna inserting the UT tube? It is a big question nowadays. Okay, actually we do have some options like laryngoscope, conventional laryngoscope. It is nothing but it is a kind of assistive tool to insert that ET tube into the patient trachea through the vocal cords. Okay, vocal cords is nothing but a voice box in our body. Okay, and the laryngoscope is first inserted into the patient body through the mouth into the exact location, and after that, after locating that laryngoscope, through that laryngoscope, that ET tube is get inserted into the patient windpipe through the vocal cords. Okay, it is very important that the laryngoscope is placed in an exact location. Okay, it should be placed in an exact location, then only that intubation will be successful. Otherwise it will cause some very much difficulties to the physician as well as to the patient as well. Okay, okay, what are all the difficulties of facing if you're using a conventional laryngoscope means it will be very useful and it will be very easy for the professional who are very expertise in that field. Okay, if the person is very very new to that field, or the person is under training means it is not possible. Okay, they cannot able to done it very quickly, or it is not possible anyways. Okay, for that, in that case, video laryngoscope plays a vital role. Okay, video laryngoscope, it is of course it is similar to the conventional laryngoscope. What is the difference between these two is video laryngoscope provides a live visualization of our body, while inserting it will provide the real time visualization, like where we are inserting, whether it goes into a proper direction or not. We can able to visualize it. Okay, that's what the major advantage, that's what the major pros of this video laryngoscope. We can able to visualize it in a real time. Okay, after that, if you're getting a good visualization, mean of course the physician or the clinician can able to insert that ET tube into the exact location. It will be very much easy. If you're using conventional laryngoscope, means it will take much time to insert the ET tube into the exact location. If you're using video laryngoscope, means it will provide the visualization, so you can make it very simple. You can of course you can locate the laryngoscope in an exact location, then you can of course you can able to insert the ET tube into the correct location as well. Okay, no need to worry about the time and all. Okay, there is a rechargeable battery option is available. You can charge it. Okay, you can make use of it. Okay, then it is an added advantage for video laryngoscope. After inserting that tube is get connected to the like oxygen machine. By that oxygen machine, it provides pressure, which means the air to the patient lungs, which makes ventilation easier to the patient who cannot actually breathe by their own, or the person who is having difficult breathing disabilities. This is the thing why we are going for intubation, which is a invasive ventilation. Okay, we can go for conventional laryngoscope or we can go for video laryngoscope in order to perform this intubation. Intubation is a very useful technology in OTs, okay, which provides and which assists the patient to get proper ventilation. This is all about today's video. Thank you so much for watching.